Book 1, Unit 1, Hospital Departments. Exercise 5, page 5.
Heartland Hospital. Heartland Hospital's dedicated staff is here to serve you. Our first-class departments include Pediatrics, provides health care from birth to adulthood. Chair, Dr. Richard Collins. Obstetrics, cares for women through all stages of pregnancy. Chair, Dr. Susan Meeks. Radiology, creates X-rays and CT scans for all departments. Chair, Dr. Thomas Locke. Pathology, tests samples for all departments. Chair, Dr. Laura Howard. Surgery, performs everything from routine procedures to organ transplants. Chair, Dr. Rachel Silver. Cardiology, investigates and treats all heart problems. Chair, Dr. Paul Sarton. Dermatology, cares for everything from warts to skin cancer. Chair, Dr. Jeff Schmidt. Orthopedics, provides bone and joint care. Chair, Dr. Catherine Newland. Emergency, treats patients in life-threatening condition. Chair, Dr. Douglas Green. Additionally, our pharmacy can fill prescriptions 24 hours a day, 7 days a week.
Unit 2, Hospital Staff. Exercise 5, page 7.
Heartland Hospital Staff Directory. First floor. Dr. Paul Sarton, cardiologist, surgeon. Office 100. C4, heart disease, heart surgery. Dr. Lydia Greenwich, anesthesiologist. Office 101. C4, surgery pain relief and preparation. Dr. Richard Collins, chief pediatrician. Office 102. C4, children's health. Dr. Ann Harold, obstetrician. Office 103. C4, labor, pregnancy. Dr. Thomas Locke, chief radiologist. Office 104. C4, X-rays, CT scans. Carol Howard, lab technician. C4, test results. Second floor, Dr. Rowan McNeil, general practitioner. Office 202. C4, general medicine. Carol Simmons, NP, head nurse. Office 203. C4, nursing schedules. Dr. Charles Thiel, pharmacist. Office 204. C4, prescriptions.
Unit 3, Hospital Equipment. Exercise 5, page 9. Medical supplies. Please keep everything in its proper place. Large items such as wheelchairs and pressure mattresses are at the back of the room. Supplies for patient rooms, such as gowns and bedpans, are on the left. Syringes are on the top shelf on the right. Dispose of used syringes in the sharps containers. Gauze, latex gloves, and other examination supplies are under the syringes. Dispose of these items in a biohazard waste container. If any items are out of stock, please submit an order form to the front desk. Oxygen tanks for patient rooms are on the second floor next to surgery. Unit 4, Parts of the Body 1. Exercise 5, page 11.
Journal of Athletic Medicine, Issue 84. Common Sports Injuries by Dr. Mark Robbins. Athletes deal with injuries on a regular basis. Below are some of the most common sports injuries. Ankle sprain. This is the most common foot injury. It occurs when the foot rolls in a twisting motion. Knee sprain. This can result from a blow to the knee or a sudden twist. There could be pain throughout the leg. Elbow sprain. An unnatural arm movement can cause an elbow sprain. Pain can be felt through the arm to the wrist or even the hand. Shoulder dislocation. A hard blow can knock the shoulder out of place. This is very painful. Hips can also be dislocated. Fingers and toes. These appendages are often jammed or broken.
Unit 5, Parts of the Body 2. Exercise 5, page 13.
Jefferson General Hospital. Patient name, Doug Robinson. Sex, male. Age, 27. Physician, Dr. Robert Moody. Time, 9:42. Incident or reason for ER admittance. Automobile accident. Apparent injuries. Head and neck. The patient suffered minor head trauma and may have a concussion. There is no visible injury to the neck. Torso. There are several small scratches on the chest and waist. I observed bruising on the abdomen and the rib cage. There is no damage to the legs or groin. Posterior torso. The patient complains of pain below the right shoulder blade. He also has a deep cut on the small of his back. Arms and legs. The patient's arms and legs appear in good condition.
Exercise 5, page 15. Patient assessment. Name, Molly Roberts. Sex, female. Age, 14. Primary physician, Dr. Joseph Nelson. Parent, guardian signature, Pamela Roberts. Home phone, 555-8889. How did injuries occur? Bicycle accident. Describe injuries. The patient has no severe head trauma. There are minor scrapes on the face and a small bruise on her jaw. The patient has one deep cut on the forehead. There are two minor cuts between the right eye and eyebrow. The nose appears bruised and the upper lip is bloody and swollen. There are scrapes on her left cheek near the left ear. Unit 7, Respiratory System. Exercise 5, page 17.
Hyde's Medical Dictionary. Illnesses of the respiratory system. Asthma. Asthma is a chronic disease of the lungs. It involves inflammation of the bronchial tubes and other airways. This causes wheezing, coughing, and difficulty breathing. One way to treat asthma is to inhale medicine using an inhaler. Emphysema. Emphysema is a progressive respiratory disease. It is the result of bronchial tube damage. In emphysema, the alveoli lose their shape and functionality when the person exhales. As a result, less oxygen is allowed to enter the bloodstream. Smoking tobacco is one of the most common causes of emphysema.
Unit 8, Circulatory System. Exercise 5, page 19.
How the circulatory system works. The circulatory system carries oxygen in blood to all parts of the body. Blood begins its journey in the heart, which beats to pump it to the rest of the body. Valves control how blood moves through the heart. Blood picks up oxygen in the lungs by traveling through the pulmonary artery. It then leaves the heart through the aorta, the body's largest artery. Blood flows throughout the body in arteries. At the end of arteries are tiny capillaries. Here oxygen moves to parts of the body. Blood without oxygen returns to the heart in veins. The largest of these, the vena cava, empties into the heart's right atrium. Then the cycle can begin again.
Unit 9, Digestive System. Exercise 5, page 21.
Abdominal pains.
Dear Dr. Diane, I've had persistent pains for 2 days. At first, there was a dull stomach pain. Lately, the pain has become sharper. I'm a little stressed out because of family and work. Friends say it might be an ulcer. Is it that serious? Painful in PA.
Dear Painful in PA, always take persistent pain seriously. Persistent pain could mean an ulcer. Pain between the heart and stomach might mean an esophagus problem. Pain lower in the abdomen could mean appendicitis. The appendix is between the small intestine and large intestine. It sometimes becomes inflamed and causes real problems. It's part of the digestive system, but its function is unknown and it can be removed without any consequences. Your doctor may want to perform a colonoscopy. That will check your colon and intestines for any serious problems. Dr. Diane.
Unit 10, First Aid, Exercise 5, page 23. Basic First Aid Techniques. In a medical emergency, always call for assistance first. The following are basic steps to take to help an injury victim before medical help arrives. Assess the victim's condition. Give him or her plenty of space. Prevent shock by elevating the legs and covering the victim. Apply pressure to lacerations or other open wounds to stop bleeding. If bleeding has stopped, wounds should be cleaned and wrapped in a bandage. Cool minor burns with running water. If the victim's pulse or breathing has stopped, CPR or rescue breathing can be performed. Be sure to clear the victim's airway before rescue breathing is carried out. Unit 11, Common Abbreviations. Exercise 5, page 25.
Scottsville General Hospital. Patient evaluation. Date, April 12. Patient name, Christine Gordon. ID number, 6612431. Sex, female. Physician, Harold Downs, MD. Attending nurse, Susan Smith, RN. Time, 23:15. Patient condition, stable. Patient vital signs, T, 100.6 degrees Fahrenheit, as taken by oral thermometer. HR, 81 beats per minute. BP, 140/90. Respiration, patient COSOB. Notes, XR shows no acute lung disease. Blood sugar levels are WNL. OE, patient appears to have high levels of anxiety. The patient is a smoker and has a high stress profession lifestyle. DX, the patient likely has HTN, but further testing and lifestyle analysis will be required. RX options will include diet, lifestyle adjustment, and medicine.
Unit 12, Measurements. Exercise 5, page 27.
Medication list, procedures for Carlton Avenue House. Patient medication chart. Pascale D. 40 MEq KCI by mouth twice a day. 1 milliliter, 1 cc, insulin injection via abdomen after dinner. Holmes F. 2 GTT saline solution in each eye every morning. Paulson G. 2 teaspoons of fish oil by mouth every afternoon. Roberts R. 1 tablespoon of dextromethorphan DM by mouth twice a day. Take for 5 days or until cold subsides. 2 grams omega-3 by mouth every morning. Francis H. 20 milligrams fluoxetine HCI by mouth at breakfast. Harrison K. 500 mcg cabergoline by mouth every night before bed. 1 tablespoon of fish oil by mouth every afternoon. Tracy A. 2.5 ounces medicinal toothpaste every morning and night.
Unit 13, Administering Medication. Exercise 5, page 29. Patient, Catherine Gates. Medical history. Medications. 0512. Ms. Gates came in complaining of a rash. She received a topical ointment to administer to the affected area. 0517. Ms. Gates was admitted to the hospital with serious dehydration and breathing trouble. She was given fluids through an IV. She was also given a 200 milligram dosage of steroids. The route of administration was an intramuscular injection, IM. 0519. Ms. Gates' persistent illness has been caused by an infection. Serious complications have arisen. Antibiotics are being given through subcutaneous injections and PR. 0526. Ms. Gates was discharged today. Her physician prescribed antibiotic pills to be taken for 2 weeks. These should be taken PO and can be swallowed or absorbed sublingually. Unit 14, Describing Frequency. Exercise 5, page 31.
BID, take twice per day. TID, take 3 times per day. QHS, take at bedtime. AC, take before meals. PC, take after meals. QOD, take every other day.
Heartland Hospital, Ward 4F, Patient Medications. Bill Foster. Give Mr. Foster 200 milligrams of heart disease pills, TID. These should be taken PC with water. Jill Richards. Mrs. Richards can have ibuprofen PRN. It should be taken AC though, so give her a snack with it. At night, she should also take her antibiotic pills QHS. Carrie Edmonds. Ms. Edmonds needs steroid injections BID in the morning and night. Her IV drip should be exchanged QH. Alex Davis. Mr. Davis must have his injections frequently QID. If his heartbeat is irregular, give him a 25 cc injection of lidocaine stat and notify the physician on call right away. Lucas Simpson. Mr. Simpson requires hydrocortisone QOD.
Unit 15, Maintaining Hygiene. Exercise 5, page 33.
From Bernard Tobin, Hospital Director. To all staff. Sent Saturday, November 15th. Subject: Hygiene Standards. Attention hospital staff. The flu season is approaching. I want to remind everyone of the importance of maintaining strict hygiene standards. Contagious new virus strains and drug-resistant bacteria cause problems every year. I do not want that happening here. Regular hand washing with antimicrobial soap is imperative. All surfaces must be cleaned with disinfectant according to the maintenance schedule. We must always store antibiotic drugs in the proper cabinets. Biohazards should be mindfully disposed of. Should drug-resistant flu strains appear, we must quarantine all infected persons. To avoid transmitting further infections, no one will be allowed in quarantine areas without a face mask. Thank you for your help. Bernard Tobin, MD, Hospital Director.
Book 2, Unit 1, Blood. Exercise 5, page 5.
Donor blood type, type A. Eligible recipients, type A, type AB. Donor blood type, type B. Eligible recipients, type B, type AB. Donor blood type, type AB. Eligible recipients, type AB. Donor blood type, type O. Eligible recipients, all types.
Silverton Community Blood Bank. Donor introduction. Donor name, Ann Lee. Blood type, O negative. Dear donor, thank you for giving blood. Your blood may save the life of someone in need. At SCBB, we provide blood for transfusions to needy recipients. Not everyone can receive every type of blood. Each person's red blood cells carry different antibodies. We are always looking for donors with type O, since everyone's blood is compatible with type O. If you are one of these universal donors, we encourage you to donate blood frequently. Recipients with rarer types, like type B and type AB, are especially in need of your help. Of course, we also accept type A, since plenty of people can use that type too. Our on-site labs analyze each sample of plasma to ensure we're providing safe blood. We know that giving recipients the wrong type can cause blood clots. While some clotting is necessary to form platelets, clotting within blood vessels can be very dangerous. We also screen all donors for infectious diseases like hepatitis and HIV.
Unit 2, Bones. Exercise 5, page 7.
Broken bones. Bone health is vital to a body's general well-being. The skeleton provides the body's basic framework, while bone marrow is an important part of the immune system. Damaged bones must be treated carefully to avoid improper healing. This guide will help you identify fractures so you can treat them accordingly. Stress fractures require fairly straightforward treatment. The bone is typically cracked rather than broken all the way through. This means no repositioning is necessary before the bone heals. Displaced fractures, on the other hand, are tricky. They require that the bone be reset before it can heal. Compound fractures and impacted fractures, for example, require extensive repositioning so the bone heals in the right place. Comminuted fractures are especially complicated because the bone is split into several pieces. If you work with children, you will likely encounter green stick fractures. These common fractures occur when young, soft bones are bent.
Unit 3, Skin. Exercise 5, page 9.
Dr. Karen Sturgis, dermatologist. Common skin conditions. Skin is the outer covering of the human body. It is made up of 3 layers. The top layer is the epidermis. The dermis lies beneath the epidermis. The deepest layer is the hypodermis. This layer stores subcutaneous fat. Abnormal skin conditions can occur when the skin is damaged, or they can be caused by factors inside the body. Here are a few common skin conditions. External causes. Contusion. A contusion is a discolored area of the skin caused by trauma. The discoloration occurs when blood escapes from damaged capillaries into the skin. Abrasion. An abrasion is damage to the epidermis of the skin. Since these scrapes do not usually cut into the dermis, most abrasions do not bleed. Internal causes. Acne. Acne is a common skin disease. It is caused by oils that trap skin cells in pores. Bacteria then grows. This results in raised red bumps called pimples or other imperfections of the skin.
Unit 4, Nervous System. Exercise 5, page 11.
The nervous system. The organs of the nervous system work as a group. Together, they coordinate the actions of the body and transmit information from one part to another. Neurons form the core of the nervous system. Other parts of the nervous system, such as the brain, are built from these. Neurons or nerve cells can transmit information by both electrical and chemical signaling. They connect to each other to form neural networks, which perform specific functions. Such networks are capable of massive amounts of information processing. Different types of neurons serve different purposes. Sensory neurons react to stimuli from the sense organs, such as light or sound. Involuntary reflexes are triggered by such stimuli. Motor neurons help the body to move. The brain and the spinal cord form the central nervous system. Information travels through nerves and up the spinal cord to the brain, which controls all of the body's systems. The spinal cord is protected by the vertebrae of the backbone.
Unit 5, Endocrine System. Exercise 5, page 13.
About the endocrine system. The glands of the endocrine system work together to control many bodily functions. Everything from hunger to childhood growth is regulated by the hormones of this system. Each gland of the endocrine system secretes one or more hormones into the bloodstream. The hormones travel throughout the body to control certain functions. Major glands of the system and their purpose include the following. Pituitary gland. This gland, at the base of the brain below the hypothalamus, secretes 9 hormones that control important functions. These include growth, blood pressure, and sexual functions. Thyroid gland. The thyroid gland in the neck below the Adam's apple, controls how quickly the body uses energy and makes proteins. Pineal body. The pineal body or pineal gland is located in the center of the brain. It produces melatonin, which regulates sleep cycles. Adrenal gland. One adrenal gland is located above each kidney. They produce adrenaline, which helps the body respond to stress.
Unit 6, Reproductive System. Exercise 5, page 15. Southwest Reproductive Health Clinic. Know your reproductive system. There is often puzzlement surrounding the reproductive system. Understanding its parts and how it works can help you maintain its health. The reproductive system is the only system in which males and females have very different parts. This includes not only the external genitalia, the male penis and female vagina, but inside as well. The gonads are the organs which produce sex cells. In males, the testes produce sperm, while in females, the ovaries produce egg cells. Should a sperm cell reach an egg cell during intercourse, fertilization occurs. At Southwest Reproductive Health Clinic, we offer a variety of services to help you maintain reproductive health. We counsel sexually active patients about using birth control and preventing the spread of STDs such as HIV. We can advise on a variety of contraceptive methods, including condoms and the pill. If you or your partner suffers from infertility, we can present you with treatment options. Unit 7, Urinary System. Exercise 5, page 17.
Patient Albert Ross, DOB 010379. Patient presents with a restricted flow of urine and pain while urinating. He also feels discomfort of the bladder since he has trouble expelling waste. Patient has been experiencing these symptoms for approximately 4 days. Patient provided a clean catch urine sample for analysis. I ruled out major diseases of the kidney since only benign casts were present in the urine. Tests revealed no signs of infection anywhere in the urinary system. Further examination of the patient revealed blockage of the urethra due to kidney stones. I recommended that Mr. Ross increase his fluid intake to pass the stones. I also advised him that dietary changes might help prevent recurrence. I referred him to a nutritional specialist for further information. Mr. Ross will return in 2 weeks for a follow-up.
Unit 8, Taking a History. Exercise 5, page 19.
A Systemed, Guide to Taking Medical Histories. As a medical professional, you should be prepared to take thorough medical histories. The data you collect reveals important details about a patient. Doctors use these details to uncover likely causes of medical conditions and establish diagnoses. First, get as many details as possible about a patient's complaint. Find out if the patient has a history of the condition. Ask when the patient experienced the onset of symptoms. Check what makes it worse and what makes it better. Then find out about the patient's past medical history. Record any previous medical problems, especially those that could relate to the current condition. Other details can also contribute to a useful medical history. A good social history includes information about the patient's personal habits and lifestyle. A family medical history reveals conditions that are more likely to occur in a particular family. Before any medical procedure, make sure you have an updated record of the patient's allergies. This way, you avoid exposing patients to medications or substances that might harm them.
Unit 9, Talking about Symptoms. Exercise 5, page 21.
Patient Linda Thomas, DOB 110679. Patient presented today with discomfort in her head and body. She said she was treated for a cold last month by another doctor, and she was worried it might have returned. Once again, she has a runny nose and is coughing. She is experiencing severe fatigue and difficulty concentrating, also as before. However, she is now also wheezing and having trouble breathing. She also reports muscle aches all over her body and a headache that throbs. The pain and labored breathing are preventing the patient from sleeping comfortably. A temperature reading indicated a fever of 102 degrees. I advised the patient that her symptoms suggest flu rather than a cold. I recommended an over-the-counter analgesic to relieve pain and reduce the fever. I also advised the patient to stay home for 2 to 3 days. She should also drink until she feels stronger. The patient will return in 7 to 10 days if the symptoms do not improve.
Unit 10, Physical Examinations. Exercise 5, page 23.
Giving a physical examination for providers of medical care. A physical examination is one of the most basic of medical care procedures. Follow these simple steps to be sure that your exams are thorough and effective every time. 1. Make sure the patient is comfortable and that the examination environment is optimal. 2. Check vital signs. With the patient sitting, take his/her temperature using an oral thermometer. Then measure the patient's pulse. Use a stethoscope to conduct auscultation of the patient's breathing. 3. Have the patient lie down. Use percussion techniques to check the condition of organs beneath the abdomen. 4. Conduct a general inspection of physical body parts. Check the arms, legs, back, and neck with palpation. Evaluate the patient's posture. Make observations of the patient's body language. It can reveal symptoms that affect the diagnosis.
Unit 11, Diagnostic Tests. Exercise 5, page 25.
Jackson Hospital. Lab results. Patient name, Clark Reed. Tested for chronic kidney disease, CKD. History. Mr. Reed complained of a decrease in appetite. He also reported having less energy. The family history includes kidney problems. This led me to check Mr. Reed's renal function. Test results. Mr. Reed's blood pressure is elevated, 151/92. A urinalysis reveals a high level of albumin present in his urine. Creatinine levels are much higher than normal in blood tests. Diagnosis. Mr. Reed likely has kidney disease that is progressing rapidly towards renal failure. Notes. A GFR test and a BUN test have been ordered. A renal biopsy should be scheduled as soon as possible to determine the cause of the disease. The pathology report should be sent immediately to Dr. Roth, room 312, 3rd floor. Signed, Dr. James Roth.
Unit 12, Diagnostic Equipment. Exercise 5, page 27.
Community Health Clinic, Medical Imaging Services. At the Community Health Clinic, we have a wide range of medical imaging techniques available. Which technique to use depends on the situation and needs of the patient. Radiography is the use of X-rays to take pictures of the internal body. It is a common imaging technique used in many different situations. A CT scan is an advanced form of radiography. It uses many different two-dimensional X-rays to create a three-dimensional image. An ultrasound uses the reflection of sound waves to create images. A special gel placed on the skin aids this process. Unborn children are often examined through ultrasounds. Recently, the use of endoscopes during examinations and surgery has become quite common. A doctor feeds a tube with a tiny camera on its end directly into the organ or cavity to be examined. Advanced imaging techniques include MRIs and ECGs. An MRI utilizes the magnetic properties of atoms to create very detailed pictures. An ECG measures the electrical activity of the heart.
Unit 13, Family Medicine. Exercise 5, page 29. Sunday Herald, Family Medicine, by Dr. John Olson, M.D. The Heart of Primary Care. For decades, the Family Medical Clinic has been the first point of primary care for millions of patients. However, today patient demand threatens to overcome the supply of family medicine practitioners. Thus, it is important to emphasize the need for these vital healthcare professionals. Family practitioners provide a variety of healthcare services to all patients, regardless of age. Not only do they treat injuries and illnesses, they also provide preventative care such as routine checkups and immunizations. They counsel patients about their healthcare options and advise a recommended course of action. They are a vital source of health education. If needed, they refer patients to specialists for specific diseases and injuries. Even though they do not work in an emergency room, many family practitioners provide urgent care to patients requiring immediate attention. Family medicine will always be at the core of the healthcare system. Medical professionals should be encouraged to follow this rewarding career. Unit 14, Pediatrics, Exercise 5, page 31.
Old Orchard Pediatrics Clinic. Quality medical care for children and families. At Old Orchard, we provide pediatric care to all children, from newborns to teenagers. It is important that infants, in the first 6 months following birth, have frequent checkups. Yearly visits should occur between the ages of 2 and 10 years. And teenagers should see a doctor at least every other year. If your child is sick, you can schedule same-day appointments by calling 555-0014 today. Special Pediatric Services. Asthma. Our team of juvenile asthma specialists is among the best in the state. Obesity. Childhood obesity is a growing problem. Treatments include an innovative combination of education, diet programs, and drugs. Jaundice. Jaundice in newborns is a common condition. It involves heightened levels of bilirubin in the blood. While it is usually harmless, certain cases require treatment. Our Billy-Light phototherapy treatments are safe and effective.
Unit 15, Geriatrics, Exercise 5, page 33.
Medical Specialties, Geriatrics. Geriatrics has developed as a field of medicine focusing on the prevention and treatment of diseases in elderly people. Common ailments. Certain diseases become more common with advanced age. For example, the risk of a stroke increases significantly. Hearing loss can require implants to maintain functional levels. Inability to be physically active can cause bed sores. Additionally, Alzheimer's disease is a terminal illness that robs people of their memories and their ability to think clearly. Other ailments, such as spells of dizziness or incontinence, could indicate more serious problems. Caring for seniors. Senior citizens must often take several regular medications. This puts them at risk for polypharmacy, which can cause dangerous drug interactions. It is important to assist seniors who may have trouble understanding when and how much medicine to take. Should their health issues make them incapable of caring for themselves, several care options exist. Assisted living centers help seniors with their medical needs while still granting them independence. Seriously ill seniors may need to be placed in a nursing home.
Book 3, Unit 1, Education and Training, Exercise 5, page 5.
What does it take to become a doctor? Medicine is a vast and complicated subject of study, and a comprehensive education is important for doctors everywhere. But different countries have different requirements for medical education. Many countries, including the United States and Canada, require students to have extensive education before they even enter medical school. In these countries, a bachelor's degree in pre-medical studies is a prerequisite to ensure students know the basics in biology, chemistry, and other sciences. In other countries, such as India and China, medical schools do not require pre-medical degrees and allow undergraduates to enter directly. Students in these countries must pass entrance examinations before admittance to ensure competency. Regardless of the process for earning a medical degree, Most countries require further training or qualifications before a doctor can practice. A doctor often completes a residency at a hospital to receive advanced training in his or her chosen field. Some programs, such as the Foundation Program in the United Kingdom, offer further schooling to prepare doctors for various specialities. In the United States, a doctor may also complete a fellowship to pursue focused research in a particular field. After completing all education and training, a doctor must also receive a license from a government authority. This process might include taking a test, paying a fee, or submitting to a background check.
Unit 2, Communicating with Staff. Exercise 5, page 7.
2. J.Wilson@gcohospital.net. From P.Hernandez@gcohospital.net. Subject: Communications. Dr. Wilson, a recent situation has come to my attention that raises some concerns about communication in your department. Several nurses have complained that the instructions in your plans of care are often disorganized and confusing. And Dr. Kowalski, who takes over for you during the afternoon shift change, also mentioned problems with your notes. He said that he had to gather information from several patients a second time because the records were so difficult to read. I have reviewed your patients' medical records and found that your notes are not concise. As you know, legible writing is vital to the health and safety of our patients. It is also absolutely necessary that you document all patient details and instructions in chronological order to avoid confusion and possibly disaster. We had a near miss yesterday when Nurse Pierce almost gave a patient acetaminophen even though he is allergic. Fortunately, the patient was awake and advised her of the allergy. Next time we might not be so lucky. Nurses should not have to make assessments about patient care. Your notes should give them comprehensive information about each patient's status. Regards, Dr. Hernandez.
Unit 3, Communicating with Patients. Exercise 5, page 9.
To all staff. Subject: Communicating with patients. Clear communication is vital to providing the best care possible. However, recently we have not been getting all the information we need. If you believe you are not getting adequate information from a patient, remember some of the possible causes of miscommunication. Poor health literacy. Uninformed patients may not understand important terms. Negative preconceptions. Patients may not trust medical professionals. They may experience anxiety when forced to interact with them. Cultural differences. Different cultures may have different approaches to dealing with illness and health care. If you recognize any of these issues, a few simple steps can be all that is required to improve communication. Establish a good rapport with the patient. Patients heal better in a therapeutic environment. Show empathy and understanding at all times. Be aware of how your verbal and nonverbal cues are affecting the interaction. Avoid using jargon as much as possible. This may confuse or intimidate the patient. Ask open-ended questions to signal to patients that you care about their input. Remember, everyone shares the responsibility of effective communication with patients. The more information we can give and receive, the better care we can provide.
Unit 4, Challenges. Exercise 5, page 11.
The ailing medical profession. Hospitals today are facing economic hardships. While most doctors and nurses are competent, hard-working individuals, they encounter various challenges that can interfere with patient care. The demand for medical professionals has increased in recent years. With rapidly rising populations, communities need good health care now more than ever. At the same time, however, the economic downturn has led to shortfalls in the budget of health care providers, so hospitals cannot afford to hire new staff. Consequently, doctors and nurses are paid less to work longer shifts and take on larger caseloads. The added paperwork forces many to work unpaid overtime just to maintain the necessary records. More and more of these workers are suffering from exhaustion. The shortage of medical professionals is partly due to individual financial hardships as well. Increases in medical school costs have forced students to take out loans and incur substantial debt before they can start practicing. And today's doctors must also pay hefty insurance premiums each month in case they are sued for medical malpractice. For many would-be doctors, these expenses are too high, and so students are pursuing more affordable career paths.
Unit 5, Describing Pain. Exercise 5, page 13. Pain Assessment Form. Patient name, Luke Carlton. Age 49. Form completed by Dr. Joe Wilson. 1. What is the location of the pain? Lower back. 2. On a scale of 1 to 10, how does the patient rate the intensity of the pain? Note, 1 to 2 equals mild pain. 3 to 5 equals moderate pain. 6 to 8 equals excruciating pain. 9 to 10 equals unbearable pain. At best, 3. At worst, 8. Right now, 6. 3. How often does the pain occur? Patient reports that the pain started out as intermittent several years ago. However, recently the pain became constant. 4. What is the nature, quality of the pain? Example, burning, throbbing, etc. Patient reports constant throbbing throughout the day. In addition, when the patient stands up, he feels a sharp shooting pain travel up his back. 5. What causes the pain? Patient works as a mechanic. He says that he spends 6 to 8 hours a day bent over cars. 6. What does the patient do to relieve the pain? Patient uses a heating pad for several hours each day. He also takes at least 4 aspirin pills a day. 7. Other comments. Patient was in some distress today when he came in. He says that the pain is negatively affecting his performance at work, as some days he is barely able to stand. Unit 6, Chronic versus Acute Illnesses. Exercise 5, page 15.
Health Chronicle, page 65. Early intervention required for chronic and acute illnesses. Many people with an illness do not seek immediate treatment. They simply believe they will eventually get better. They may not think that a pre-existing medical condition could actually worsen if they contract another illness. Such thinking is dangerous. Both chronic and acute illnesses that are left untreated can grow more severe. They can lead to even more serious complications at a later time. Early intervention of chronic conditions is a must. Inadequate treatment can actually result in the occurrence of a serious acute condition. For example, improperly managed osteoporosis can lead to broken bones. Likewise, chronic bronchitis that is left untreated increases the risk of dangerous acute respiratory conditions like pneumonia. Similarly, delaying treatment of acute conditions can trigger the onset of chronic ones. For example, a case of scarlet fever caused by strep bacteria can lead to endocarditis. Not treating the fever in time can create life-threatening and long-term problems. Chronic high blood pressure is a risk factor for several life-threatening acute conditions, including stroke. Fortunately, there is good news. Visiting a doctor in the early stages of an illness can help you avoid dangerous complications later. Seeking treatment early on can save time, money, and possibly even your life.
Unit 7, Diabetes. Exercise 5, page 17.
About diabetes. Type 1 diabetes. Type 1 diabetes mostly affects children whose bodies are unable to make insulin. Only 10 to 15% of people with diabetes have this type. Type 2 diabetes. Type 2 diabetes is the most common form of the disease. It usually affects adults. It results from poor insulin production or from insulin resistance. Gestational diabetes. 4% of pregnant women are diagnosed with gestational diabetes. This disease operates essentially the same as other types. blood sugar usually returns to normal after birth, but the patient has a greater risk of later developing type 2 diabetes. Causes: 1.6 million cases of diabetes are diagnosed each year. There are certain risk factors for developing type 2 diabetes. These include genetics, race, a high BMI, high blood pressure, and a diet high in fat or alcohol. Complications: diabetes reduces blood flow around the body. Thus, it can cause problems in many parts of the body, including the eyes, kidneys, nervous system, sexual function, teeth, and gums. It can result in heart attacks, strokes, cataracts, glaucoma, blindness, and even amputations. Treatment: it is crucial to manage diabetes effectively. Treatment plans are tailored to each patient to help keep glucose levels within a target range. Diabetes management generally includes lifestyle changes such as increased exercise and insulin medication.
Unit 8, Cancer. Exercise 5, page 19.
Cancer treatment options. It can be very frightening to be diagnosed with cancer. Fortunately, today there are many treatment options available. Your oncologist may suggest one or more of these therapies. Chemotherapy. Chemotherapy, or chemo, is a drug or combination of drugs that kills cancer cells. It can be taken orally, though the most common delivery method is through an IV injection. Chemo can be received in a hospital or outpatient setting. Your doctor may prescribe chemotherapy before or after surgery. Potential side effects include hair loss, fatigue, and damage to specific organs. Radiation therapy. Radiation therapy, also called radiation oncology, destroys cancer cells with high-energy X-rays. It works best on cancer cells that are splitting very rapidly. It impairs a cancer cell's DNA so that it cannot grow or divide. Immunotherapy. Immunotherapy strengthens the patient's immune system. New antibodies are introduced to the patient's system. They target cancer cells and destroy them. Photodynamic therapy. In photodynamic therapy, patients are given a light-sensitive drug containing cancer-destroying substances. Light beams then activate the drug, which has been absorbed by cancer cells. Anti-angiogenesis therapy. Like normal cells, tumors need a blood supply to survive. Anti-angiogenesis therapy prevents a tumor from making new blood vessels so that it cannot grow larger.
Unit 9, Heart Disease. Exercise 5, page 21.
What is heart disease? Heart disease is the leading cause of death of the U.S., but many people know little about it. Heart disease is a term that covers several problems that can affect this vital organ. Types of heart disease: coronary artery disease, atherosclerosis, and arrhythmia are all forms of heart disease. They affect the heart in different ways. For example, in atherosclerosis, fatty materials harden artery walls. Prevention: simple measures can reduce your risk of getting heart disease. Stop smoking. Exercise regularly. Get regular checkups. Reduce stress. Eat a heart-healthy diet. Treatment: coronary artery disease can be treated with an aspirin regimen or other drugs. Atherosclerosis treatment often involves taking medications known as statins along with other drugs. Arrhythmia may also be treated with drugs, but a pacemaker can be installed to keep the heart in a regular rhythm. General treatment plans may involve lowering high blood pressure and cholesterol. Surgical options for heart disease include installing stents or performing open-heart surgery to bypass plaque buildup in the arteries. Another surgical option, angioplasty, widens blocked arteries by inserting and inflating a balloon. It is critical to take care of your heart. Be sure to follow the prevention tips above and get regular checkups.
Unit 10, Traumatic Injuries. Exercise 5, page 23.
Heartland Hospital, ER Triage Guidelines. Heartland Hospital strives to provide the best care it can with limited resources. To ensure that each patient is seen at the appropriate time and receives quality services, please follow these guidelines for the triage process. Trauma patients who arrive with obviously critical and life-threatening injuries receive the highest priority. They should be taken to an available trauma room immediately. Any necessary staff and equipment should be devoted to them until their vital signs are stabilized. All other patients should report to the triage station to undergo an assessment by a nurse. The nurse will utilize the Emergency Severity Index to determine the severity of a patient's injuries and when they should be seen. This is a common-sense system that ranks patients according to the danger level of their situation. For example, an open wound will rank higher on the index than a minor illness such as a low fever. The nurse will assign an ESI level between 1 and 5, with 1 being the most serious, to each patient. In this way, patients will be seen according to the acuity of their injuries.
Unit 11, Infections. Exercise 5, page 25.
May issue. Journal of Hospital Issues. Stopping infections in your hospital. Hospitals are full of vectors of infectious diseases. According to estimates, about 1.7 million American hospital patients get a nosocomial infection each year. Healthcare facilities have a responsibility to be vigilant about protecting their patients from infections. There are many simple ways this can be achieved. The majority of illnesses are spread through touch, so it is essential that hospitals have many hand-washing stations available to patients, visitors, and employees. Problems like E. coli and staph infections can be prevented by using alcohol-based hand sanitizers. However, these sanitizers do not kill all bacteria. Washing frequently with soap and water will help guarantee reduced infection outbreaks. Hospitals should try to prevent illnesses before they spread. Diagnostic tests can detect infections, such as those caused by drug-resistant MRSA bacteria. Catching an infection early is a key step to stopping it in its tracks. Finally, hospitals must have standard processes and tasks for procedures. For example, in intensive care units, nurses should brush their patients' teeth regularly. This kills the bacteria that causes ventilator-associated pneumonia. Similarly, LPNs should have checklists of the steps for fitting patients with urinary catheters, since an improper fit can lead to infection. In addition, cleaning procedures for medical tools must be followed carefully. It is equally important not to contaminate sterilized tools.
Unit 12, Nursing. Exercise 5, page 27. Part-time LPN. Immediate openings for licensed practical nurses. Duties include: perform basic health assessments with supervision, clean and dress patient wounds, monitor and report changes in patient condition, ensure exam rooms have appropriate supplies, record patient information in electronic health records. Qualifications: have a high school diploma, be a currently licensed LPN, minimum 1 year experience. To apply, email hr@mountainviewhospital.org. Reference job ID LPN 3425 in subject line. RN, Pediatric Unit. Full-time registered nurse needed in Hospital Pediatric Unit. RN will be in charge of administering vaccines and other medications by injection or orally, developing, implementing, and modifying patient care plan, ordering tests and preparing patients for tests, tracking patient flow for unit. Qualifications: bachelor's degree and RN license, 3 years experience, at least 1 year in child medical care. Send resume to North Shore Medical Center, 324 Main Street, box number 29, Buffalo, New York, 14265. Nurse Practitioner Board Certified. Qualified NPs needed for general practice. In addition to serving as the point of entry for incoming patients, you will prescribe medications and other types of treatment, perform annual physicals, tests, and minor procedures, diagnose patients and create care plans, counsel patients and families on preventative health care practices. Qualifications: master's degree in nursing and licensure. Minimum 5 years experience. Apply at www.unitedhealthsystems.com/jobs. Search for posting number 349868. Unit 13, OBGYN, Exercise 5, page 29.
Midwest OB/GYN Clinic. Services offered. At Midwest OB/GYN Clinic, we offer complete medical care for women at every stage of their life cycle. Many specific services are tailored to pregnant women and those going through menopause. Pregnancy. Midwest OB/GYN Clinic provides care during all 3 trimesters of pregnancy. Regular appointments and ultrasound safeguard the health of both the mother and child. Our clinic also conducts fertility treatments for women finding it difficult to become pregnant. For example, some women undergo progesterone therapy before and during pregnancy. Midwest also offers classes for expecting parents. Topics include how to prepare for labor, what to do when your water breaks, the possibility of a C-section delivery when necessary, and what to do when you arrive home with your newborn. Please remember that our clinic does not provide emergency services. You should contact the hospital's OB triage station if you are having rapid contractions or experience a medical emergency during pregnancy. Menopause. Menopause is a natural stage in every woman's life. Still, the hot flashes, emotional impact, and other effects can be difficult to handle. Women going through menopause can schedule regular appointments at our clinic. We can advise patients on lifestyle changes to make menopause more comfortable. We also offer hormone therapies such as estrogen treatments should they be necessary.
Unit 14, Neurology, Exercise 5, page 31.
Medical specialties, neurology. Some of the scariest diseases can be those that take away our ability to move or think clearly. Neurology has developed as a field that specializes in treating disorders of the nervous system, everything from the brain to the nerves in the fingertips. Neurologists are trained to investigate and treat these diseases. While we often think of neurology as focusing on the brain and spinal cord, the central nervous system, it actually concentrates on nerves throughout the entire body. This peripheral nervous system consists of nerves that extend throughout the body's limbs and organs. Part of this is the autonomic nervous system, which controls bodily functions at the subconscious level, such as heart rate. Disorders can strike at any of these systems. Some ailments, such as feelings of vertigo or numbness, can be treated with medication, but they may also be symptoms of a more serious condition. Patients with recurring seizures may also be placed on regular medicine. Severe trauma to the brain or spinal cord can result in paralysis or a coma. A neurosurgeon may operate to address the problem, but the effects may be lifelong. Unfortunately, many disorders have no cure or treatment. For example, Alzheimer's disease, which slowly takes away the ability to think clearly, cannot yet be stopped by modern medicine.
Unit 15, Surgery, Exercise 5, page 33.
Before your operation, what you need to know. It is common to feel nervous before surgery. While there are risks involved in any operation, it is important for you to feel calm and confident in your surgeons. This pamphlet will help you prepare for your procedure. You will meet with several doctors pre-op to discuss the details of your operation. Surgical preparation depends on the patient and the procedure. A heart transplant is quite a different operation than the resection of a lung tumor or gallbladder excision. In any case, an anesthesiologist will speak to you about being put to sleep during the operation. You will likely be under anesthesia the entire time you are in the operation room. Surgeons have many tools to help them perform their tasks. Be assured these tools are sterile, with replaceable parts changed between each operation. Scalpels help surgeons make very precise incisions and other cuts, while clamps temporarily hold things together. When you wake up, you will have sutures holding your incisions together. Your surgeon will tell you when these can be removed. After the operation, you will awake in the recovery room to begin the post-op healing process. This will involve regular medication and follow-up visits to your surgeon and other doctors.
AVN Pharma Education.